Okay, welcome back to Crush Medical. I have another high yield board exam question here. Make sure to like and subscribe if you find this content helpful. Help us grow so I can continue putting out free content. Check us out at crushmedical.com where I have a free MCCQE1 study guide, which a lot of students have followed to a T and scored really, really well and passed on their first time. Check us out there. And also check out the high yield Anki deck that a lot of students have also bought. That's one of our best sellers, and they all reported very, very strong feedback for that. Okay, let's just jump right into this question. Okay, so we've got a 29-year-old woman. She's G3, so gravida 3. 3 times she's been pregnant in her entirety of her life. P2, which means paro 2. She's carried 2 full-term, essentially full-term babies, and aborta 0, so no concerns there, right? So she presents at 9 weeks gestation for routine prenatal care. She is asymptomatic. Ultrasound shows a simple 5 centimeters fluid-filled left ovarian cyst. At 20 weeks, a repeat ultrasound shows the cyst has enlarged to 9 centimeters. She remains symptom-free. Which of the following is the most appropriate next step in management? So, let's just take a step back quickly and look at the whole clinical picture before we kind of whip through the options, okay? So a 29-year-old woman, G3P2A0, that's very reassuring, right? So it's not like she has a history of abortions or any complications. So now we can move forward. 9 weeks, she had a cyst that was found that was 5 centimeters. At week 20 now, it's 9 centimeters, right? So it almost doubled in size. So that's the first important thing we have to take away from this. The second component is that she's actually symptom-free, right? So this is different from someone who's complaining of any abdominal pain, any discharge, any bleeding. That automatically changes what's going on here, okay? So now that we've kind of established a quick framework, let's kind of go through the options, okay? Option A, proceed with laparoscopic cystectomy in the second trimester. So students love choosing this for some reason, right? They love to just get into this. They think she's pregnant and she needs an invasive procedure. So in this case, that would be incorrect. So surgery is for symptomatic patients, or if it's complex, suspicious, or even a complicated cyst, right? So this one is generally a simple 5 centimeters fluid-filled left ovarian cyst. So is that great? No. But is that terrible? It could be a lot worse, right? It could be complicated. So going back to option A, this grew but stayed simple and asymptomatic. This is avoidable, right? So we don't need to do any procedures, especially not right now, okay? Moving on to option B, order a pelvic MRI to further characterize the mass. So that would be incorrect here, okay? Another really important distractor, for some reason students love to choose this. MRI helps only in indeterminate or complex cysts, right? So because this is a simple 5 centimeter fluid-filled cyst, it doesn't warrant any further imaging. If you had a complex cyst and you had indeterminate margins, you can't really establish the size or the contents. For sure, you would want to push for MRI to get some more confirmative and diagnostic studies to establish a baseline. But because we've already done that and we've ruled out that this is just a simple cyst, she doesn't need any further MRI or any imaging. Okay, wrong here. Option C, continued observation and reassess with ultrasound after delivery. I think this is correct, and therefore it is, right? So simple, unilocular, anechoic, and asymptomatic. Most resolve spontaneously. So that's the most important thing. Number one bullet we can take away from this is that it's a simple 5 centimeter cyst that's fluid filled. Generally, this would resolve on its own, right? It doesn't need any imaging, does not require any invasive procedures. It would actually just go away on its own with time, right? So most resolve spontaneously, expected management, so supportive measures. Of course, that's always supportive and helpful, okay? The biggest thing is for this patient, she has reassuring features. It's simple, it's not lighting up for any reason on imaging, and it's not a complex cyst, right? And again, another important thing is she's asymptomatic, no discharge, no pelvic pain, no irregularities like that. That would imply perhaps a torsion, rupture, which are emergencies, right? That is something you would straight need to address right away. So And of course, ultimately, number 3, avoid any interventions in pregnancy, right? So surgery is reserved for symptoms, suspicious features, or even complications. High yield bullet for this question, clinical vignette here. Simple, asymptomatic, you just do expectant management and reassess them, right? You do want to follow up to see that this resolves and it doesn't linger or it doesn't, God forbid, it doesn't expand or become complicated. So therefore, you still would need to follow up on this, so be aware of that. But also assess for any symptoms, torsion complications, not simply just size, okay? So C is therefore your correct answer. Let's just go over option D, perform ultra-guided cyst aspiration. We can already say this is incorrect. Why? Because it's simple and it's asymptomatic. She does not require any aspiration, okay? And more importantly, if you were to actually go ahead and do this procedure, you're gonna actually risk the chances of cyst recurrence, right? So it's not even like this is a complete solution. Chances are they would just come back. So be aware of that, okay? And last but not least, last option, schedule an exploratory laparotomy. Not for this patient. This is a very invasive procedure for highly suspicious masses or acute emergencies. Far too aggressive here, okay? So again, very high yield question. Go over this a few times if you need to. Very simple, but often overlooked, and students will skip out on just observant and supportive treatment options, and just to jump right into invasive procedures or MRIs. So be aware of that. Don't fall for this trap, and we'll see you in the next video.